Those are the 8X. It says on the bottom there.
That's insane. They can make it 8X this small.
I know. Yeah, you'll have to try them on. So let's do a little intro.
Sure.
So we're already rolling. You guys already know me, Chris Nelson, DDS, and I would like you to introduce yourself, and then we can kind of talk like what we're doing today.
Sure.
Yeah.
My name is Evan Hoyer. I'm the Northern California SurgiTel sales rep. I've been with the company about 3 years. That's me.
Right on. And he drove up from the Bay Area, which if you know, California is really big, and I went to dental school down in San Francisco, so I know that drive very, very well. It's kind of boring until you start getting up north, and then but then it gets really pretty. And you're up in Mount Shasta today too, which is another hour north, and it's a lot of driving today.
Yeah, a lot of driving, but beautiful day. It's been rainy lately, so today is a beautiful day. And
roll down the windows.
Exactly.
So here we are. I actually have a whole collection of loupes here on the table, and I've done other videos. If you haven't seen them, I've done other videos on my loupe comparisons and collections, and that's we connected through a mutual friend, and my mutual friend said, "Hey, if you think your loupes are good, you got to go check out the SurgiTel loupes." And I was like, "Well, I already have a lot of loupes," but then I looked and saw that SurgiTel has the ergonomic loupes in really high magnification, and I have been really enjoying the Designs for Vision 4.8s, I think they are 5X, right? Designs for Vision and the Hero Loupes in those magnifications. So I'm like, well, if their optics are awesome, I want to get into it. So we connected, and full disclosure, we're going to do a review unit. But I'm thinking, because I actually used to have some SurgiTels. I really liked them, and right at the end of dental school, I sold them because I needed some money. I had like my original pair from dental school, so I sold them to a friend. But I really enjoyed them back in 2009 and 8 and 7. Yeah. And I paid my own money to buy them in dental school, and I had the Oakley frames and the whole thing. So I'm excited to check it out. We're also going to do we'll cut the video a little bit, but you guys can see our conversation and the process of trying on new loupes. So.
I was wondering if was your first pair of SurgiTel loupes the front lens mounted ones on an Oakley radar frame?
Yeah, they were flip up. I had a black frame. I'll tell you what I remember about those. I really liked the optics, but because the optics were mounted in front of the frame, the image circle was very small. Because if you take like a loupe and you put it closer to your eyes, you're seeing more. It's bigger relative to your eyes. So that was the one thing, and I'd ordered them I think in 3.5 because that was like a lot more magnification than my 2.5 from dental schools. Yeah. I remember that was the one thing that I didn't like. But the reason I got the flip up is because in dental school, you're constantly like getting up, and I didn't want to like take my stuff off, so I just would flip them up and then walk around the clinic and go find an instructor, and it worked. Yeah.
We used to sell a real lot of front lens mounted, and like you mentioned, the two real big drawbacks of the front lens mounted is the mechanism holding the front lens mounted is heavy. Yeah. Also, it's pulling it out further from your nose, so it's putting even more weight on your nose. Plus, it's pulling the oculars further away from your eyes, and as you mentioned, the closer the oculars are, the wider your field of view. So 98% of what I sell now is through the lens, although there's still every once in a while a customer that just loves the flip ups.
If you look at my collection, this is just part of my collection of loupes. They're all through the lens because of those reasons that I figured that out in 2009, and but I appreciate that you pointed that out. Yeah. So what do you have on the table? I have my collection here. Yeah. What do you have?
So I've got just some regular 2.5 loupes that I want to kind of explain how we started with Ergonomics. Then we have our Ergo Deflection Loupes is our brand name for our Ergo loupes.
Sure.
Ergo is kind of almost a
catch-all.
Just a catch. It's a marketing term.
Nobody really owns that, right? I mean,
nobody does. But for the longest time, SurgiTel was known as the ergonomic company
because of the declination angle, right? Yeah. So you could sit up straighter. I mean, you'd have to look down, but you weren't bending your whole head.
Exactly.
Right.
And Dr. Chang, our president and CEO, his whole goal is to save clinicians' necks and eyes. And so he actually invented the HUD system, the heads-up display system for fighter jet pilots. And this is really evident if you've seen the new Tom Cruise Top Gun movie, Maverick.
Yeah, I love that.
They're going through the canyons and they're going, huh, huh, and you can actually hear them breathing heavily because every time they make a move like that, the G-forces are pulling the air out of their lungs, but they're keeping their necks up perfectly straight. Well, their controls are down here, and if they had to tilt their neck down to check a look at their controls, and they're pulling up and they pull heavy G's, with that heavy helmet could actually snap their neck.
Yikes.
And so Dr. Chang's first job after he got his PhD was to create the heads-up display system for the Air Force so that the displays are projected up on their screens.
Yeah.
And so in Top Gun Maverick, you can see them looking straight forward, but their controls are actually up on the screen, so it allows them to keep their necks perfectly straight up and down. So anyway, he had clinician friends, doctors, dentists, hygienists that all had the same problem, craning their neck all day with the old style of loupes and
100%.
having neck issues.
100%.
So he took it upon himself to create his own loop company in which he could have a steeper declination angle on his loops so you could be more ergonomic and upright. So for 20, 30 years, we were known as the ergonomic company because we had the steepest declination angle on loops.
Yeah, you can see that. That's crazy.
We actually float them down below the lenses, and he patented that. So we're the only company that's been able to do this whole time.
Oh, wow.
So we've been able to achieve a really steep declination angle on our loops.
Yeah.
Now everybody has ergo loops, or what we call ergo deflection loops. So it's kind of like, cut the line, and now everybody's offering ergonomics. So now ergonomics is a big buzzword that's out there. Yeah. But we've always been the ergonomic company, and so right away we came out with ergo deflection loops. Yeah.
That's awesome. I do like that. The one thing that I'm also noticing in these is they don't have a ton of distortion. So what I'll do, and I like going to trade shows and looking at all the little tiny loop companies, and so I'll because I'm just such a nerd about that, and I'll actually take a pen out, and because it's parallel walls, and I'll go like this up and down, and you can actually see how much deflection. And being really into photography, higher quality lenses and different lens designs have different pros and cons. Yeah. So these ones, these are beautiful optics.
Yeah.
So, cool.
Yeah, so that just to go further on that point of how there's a lack of distortion on these, we do have ones these are the EVX models. We have an EVC model, which is a curved, so it's more of a fish eye lens.
Yeah, like a wider view.
So definitely, some people, we kind of made it because Designs for Vision customers, they all have that curved view, and so when they would come over to be our customers, they'd be like, how come yours looks different?
Wide.
So we have that option for those customers that prefer that fisheye look, because it makes it real clear on a tiny spot, but then around it is a little bit distorted. So it's not my favorite view, and we sell certainly more of the EVX models than the EVC models.
That one's about a 2.5.
2.5.
Yeah, that's what it looked like. But the super clear, nice. Yep. The other thing, I'll just tell you, because it's like I don't have any skin in the game with this stuff. I mean, I did get the Hero Loupes on the table as a review unit, but my main thing about the loupes with the built-in bend on them, the ergonomic loupes, these pairs have less contrast, and they don't have much distortion, which is cool, but they have less contrast. And my theory is that because there's light bouncing off of reflectors or mirrors or some magic in there, and so that's the one thing I'll be paying attention to on these. The other thing is I do kind of like on the ergonomic loupes that the loop is actually mounted up higher in the frame, so you can see under it. Obviously, these optics are a little bit larger, and they which takes up space in front of your eyes. But sometimes with these, you can actually look below the lenses, which is kind of nice because you can see your hands. A traditional loop like this one, as you mount them lower, you maybe lose sight of your hands a little bit more. So, but it's all pro and cons. It's just
with newer customers, we always have to go over that. People say, I heard there's a big learning curve to ergo deflection loops. And there is a bit, depending on how old you are, how long you've been using standard loops, but people are used to looking over the top of their loops to get their instrumentation and talk to the patient or whatever.
And then tilt their head up.
And then, tilt their head up for the magnification.
It's opposite.
Exactly.
Where you actually look out and down.
which I prefer because now your neck's in a perfectly ergonomic position the whole time. You're looking underneath, and then as soon as you're ready and you got your instrumentation ready, you just look straight forward and you're right on it. And so it just keeps you, if you're 100%. Ergonomically inclined, this is the Loupe for you.
All right, let's try these on. These are cool frames too. They're sparkly. So
yeah, that's our Oakley radar frame. Yeah. Now, I don't know, this is my generic demo Loupes. I don't know that's going to fit your pupillary distance perfectly, but
it's pretty close, actually. Good. Yeah. Good. I probably would adjust the
declination angle.
Exactly.
Yeah, so this particular model has our least steep declination angle. Okay. So just note that that's something we'll measure today, and we'll.
And then this one's probably. Let me guess. This is probably like a 4 or 5. Maybe, or
it's a 3.5.
Oh, a 3.5. Oh, wow! I can't wait to see those.
I know.
Yeah, that's another thing is when I do kind of more of a long-term review of these and the others, I actually want to kind of do a comparison of the like claimed zoom, because I was like, oh, this is a 4 or 5, and you're saying it's a 3, so
yeah,
you know,
it's definitely been an issue with other companies. We feel like understating or overstating, I should say, the magnification. They're 4.5s are really a 3.5, or their 3.5s are really 2.5. Ours are, you know, I feel pretty true to the magnification.
I'm only, with this pen here, I'm just seeing like that much with this, so yeah. Anyways, these look great. The contrast is not a whole lot different than these. I don't know, I'd have to stare at them, but that's pretty amazing.
Yeah.
Right on. Okay.
So the next step up's 4.5.
Okay.
This one has a little steeper declination angle. Might be more comfortable for you. This also has our ErgoFit nose pads.
I was noticing that because with the Loupes, it's moving the nose pad more towards the user.
Yep.
But yeah.
And you can go either way. We can install it with the ErgoFit or without it.
Dang. Mm-hmm. Wow. That's way in there. And I'm really impressed too with the and this is not just me saying it. Like, I don't have any skin in the game here. Like, that contrast and distortion, the contrast is very high and the distortion is very low. I guess most people would just call it like a picture quality is like really good.
Yeah.
What you will notice, but I think it's normal with any higher magnification Loupe, is the actual depth of field, like what's in focus and out of focus is very shallow. But that's, in my experience, that's normal for all Loupes that are higher magnification.
Mm-hmm. Yep. Yeah. Typically, the higher the magnification it goes, the more narrow the field of view, as well as the field of view is not as deep every jump in magnification.
Exactly. Yeah. That's wonderful.
So
do you like putting them like this or like that?
Doesn't matter. Ours are pretty sturdy, and I've done both ways.
Okay.
So here's a 5.5.
Okay. All right. That last set was a lot. Wow. Whoa. So now we're all the way down to like about an inch. So I would say just right off the top that the zoom, if you want to call it, of your Loupes is the claimed zoom is way more than and that combined with the really awesome image quality here is pretty incredible. The other thing that people will notice too is as you go up in magnification, the image is darker just because there's less light getting through the optics. This is
6.5.
Okay, this is crazy.
Yeah.
I told my staff today, I was like, I'm going to try on some Loupes from SurgiTel, and I said if I end up getting the highest magnification, I grabbed a couple highlighters and said that this is like I was like, this is what it's going to look like, and they're like, you're going to look goofy, and I'm like, I don't care. Holy cow! So now we're like up in microscope territory.
Yeah.
And I've actually never worn a pair. These ones don't fit me at all, but I'm going to just kind of fudge it a little bit. So. Where are we? Well, now I'm out here, but wow. Definitely could not do an exam with these. Like, these would be for procedure only, right?
Yeah, absolutely.
Because it's literally like, and this, you said this is a 6?
6.5.
Okay. Let's push a pause here for a second. I'm going to show you guys. I'm at like, here you go.
Sure.
I'm at about like a half an inch on the pen with a 6.5. Okay. So this is an 8, and the 8 is about double that. So we're out about here. Sure. And also just dramatically different amounts of contrast. Now I don't have the light on, that helps, but the optics on that are, I think, really nice. Let's just put it that way. You know, I mean, these are great loupes. I do love them. I use them a lot, but like, it's kind of like camera lenses. There's different quality levels, and the camera lens on the camera right now is not like it's not a $10,000 camera lens,
right?
But it's doing the job.
Yeah.
You know? So, okay, let's keep.
Our optics. I was gonna say our optics are really top notch. Dr. Chang, when he started the company, he bought General Scientific Corporation, which is a optic company. They made telescope lenses, camera lenses. They were a lens manufacturer, and so he's always been into really high quality optics, and so the form might not be as great as the function on these, not quite as short as some other loupe companies. However, the view and the optics are really, really top notch in my opinion. Well,
and if you're doing like a recall exam, I don't need the best image quality. I mean, I want to be able to see, but I might actually prioritize like a really small optic so that I can see around it, you know? But then if I'm doing like endo, I mean, I can't wait to see it. I think you have some even higher magnification. So if you're doing endo or surgery, microscopic like things, you want the highest image quality, I would imagine, right?
Yeah.
Just don't think that I probably, with my giant collection of loupes, like even though I have a lot, I don't like switching them throughout the day very much.
Yeah.
And I think that this would be just like total overkill. It's such a small area of view.
Yeah.
I mean, like, I think you'd have to look around a single tooth to work with these. So I think something less magnifying would be better. The real question is, and you know, which other one?
Exactly. Yeah. So whatever one you're comfortable with. I was going to mention this Oakley radar frame is such a big seller of ours, by far my most popular 100%. Frame. However, it does have its limitations. As you can see, the oculars are very long, so they put a lot of torsion on the glass. So we can only put 3.5 and 4.5 on the Oakley radar frame. Then once we go 4.5 or 5.5 and above, we need to use this more stable classic style frame.
Well, let's try the highest magnification with the Oakley frame.
You got it.
And the other thing, I mean, the Oakley frame looks really cool. That's fun. But also from an eye protection standpoint, so I brought, like, these are my eye protection glasses. They're a pair of Oakley, they're like a PPE style. They made these during COVID.
Oh, cool.
And they fit really, really, really snug, and they don't have any rubber on them, so they're easy to clean. So they're better eye protection. And if you've done dentistry long enough, I'm sure you've had things that have come up and hit you in the face or close to your eye. And so these also are nice because you don't have to have side shields. Because they come around, and all of my loupes that have side shields, like, they're always like loose or move around. So okay. So are all of your magnifications in half increments?
Till we get to after beyond 6.5, we then go 8 and 10.
So this 3.5, I would, if I only had one pair of loupes, this is like the big recommendation. If I only had one pair of loupes to get, and maybe if I was like a hygienist or a dentist in dental school and they wanted their like a second pair of loupes, or even if they found this video before they were making a decision, I'd probably go with the 3.5 with the deflection, the ergonomic style loupes. And these, I've worn so many different pairs of loupes over the years. These do not look, the optics do not look like ergonomic loupes. Like, they're, I don't want to throw shade at the other manufacturers because they're good loupes, but these are better. So, and like I said, I mean, I'm going to get a pair for review, but these are my own opinions. So, they're fantastic optically.
Yeah. I was going to mention, we do notice that people typically like to go up in magnification with ergo deflection loupes because instead of working like this, you're working like this, and we're adding working distance. And so because the object's further away, to make it look bigger just seems to make sense. So people that use 2.5, 3s go up to 3.5. People that are already using 3.5, it's an easy jump to 4.5.
Yeah, okay.
So,
So I think I would personally want to get a pair of those, the 4.5s with the Oakley frames.
Great.
Cool.
So now I was going to say, another thing we'd like to pair it with for you is our new light. So we have a new surgical LED mini.
Okay.
It was specifically designed for surgery, where typically surgeons, if they're orthopedic and they're doing incisions, the light's absorbing into the tissue, and they just want the most light possible. For dentistry, you guys are working on teeth where the light's bouncing off of white teeth back into your eyes.
Yeah.
So when at the beginning of this video, I was mentioning Dr. Chang's 2 goals were to save clinicians' necks and their eyes.
Yeah.
So he's always been very concerned with the amount of blue light that's in LEDs, because there's just a thing with LEDs. They have tons of blue light naturally, and so you really have to filter it out to make them safer for dentistry. And so he's always had the least amount of blue light in all of his lights, and all of our lights come in, well, all lights except for this one come in 3 different color patterns.
Okay.
Warm, neutral, and cool. Cool being having the most blue light, looks the whitest when you see it on paper versus a neutral or a warm light. So for this light, because it's so powerful, it's 100,000 luxes bright, which is, to give you a reference, our normal light is 60,000 luxes bright.
Right.
We recommend certainly for dentistry to go with a neutral light. So that's what I have attached here is the neutral micro light, which is a little bit smaller of an optic, so it's lighter weight. Yeah. We have a larger optic.
This is lovely. Yeah. The size. Yep. Also, it's not going to get in the way of like seeing the optics. Exactly. Some of the I've used, back almost 20 years ago now, the big giant optics. I also remember doctors like that would have the cord they'd plug into a thing in the room and then have, remember watching that? Yeah. Now, that's interesting that you talk about color temperature. So I remember reading an article, and I think it was Gordon Christensen, but it could have also been from Dr. Degoni at the dental school I went to. One of those 2 people in my head, I'm hearing, I remember reading an article about the blue light with your eyes and the magnification. So actually, almost always, I leave the filter on the orange filter on my Loupe. I just leave it on. Like, some people will like flip it over and then work, and sometimes I do that, but most of the time I just am like, I'll just leave the orange filter because then I don't have to worry about my composites, and it's maybe better for my eyes. Sure. But if you could select the color temperature of the Loupe light and have it be on the warmer side, then that would be a nice balance. Yeah. And then our overhead lights have a composite mode anyways. Great. So I'm excited to see what this is about. Yeah, so it will come with a curing filter. This is just my demo model, so I don't have it on here right now. But you're saying you have the option of just turning it down. This one can be adjusted from low all the way up to high and anywhere in between. So I'd be curious to see. You're welcome to keep that composite filter just on all the time, or try it because it's a neutral light, has way less blue light. You might just be able to deal with the light on its own. Yeah. And I've never really had like, and again, I'm pushing this down on my ears just so I can see through the optics with these ones. But I've never really had like a necessarily problem with the blue color. But I just remember reading the article and just kind of going, well, I want to do this for a long time, Exactly. And most people, when especially young students, when they first see a light for the first time and you see one with more blue light in it, it comes off as brighter. Yeah. It has more blue light and it looks whiter and it has a little bit more pop to it. However, the technical brightness of the lux, the amount of luxes is the same with our neutral, cool, and warm, just they're different color temperatures. And so the neutral actually gives you a little bit better color balance. So when you're trying to see gingivitis or you're trying to see the different colorations in the teeth, you can see a little bit better with a neutral light than you can with a bright white light that washes out the teeth and washes out the mouth. You can't quite see as much contrast. So I prefer the neutral. Yeah, I pay attention to color temperature. Doing the photography stuff, this looks really nice. It doesn't look super warm. It doesn't look super cold or blue. Yeah. And as far as the actual optic, like I can't even because of the loupes, I can't actually see I'm a little bit, but it just is. It's not obtrusive, and it also doesn't make the loupes any heavier. Right. Which is, I think that's the main thing is. Even all my loupes have designs for vision lights on them, just because that's what I already had the system, and these are small optics, but this thing's even smaller, so that's cool.
Also comes with a new, bigger, improved battery. So our standard battery lasts 9 hours on high.
Okay.
If you crank it down to medium or low, it'll last significantly longer. This one lasts 12 hours on high. And so real long-lasting battery.
Yeah,
and go for several days without needing to charge.
You want the like big giant battery and the small light source. Yeah. So I actually have on mine. I have a small LED daylight micro from Designs for Vision. I paid for this with my own money, but this battery actually doesn't even last. I mean, it does not last a day. I have a lot of them, but it's just kind of like it's less convenient. So okay, that's amazing. Right. So how do we get fitted and like what's the next step?
So let's measure you up.
Cool. I'm having a good time. I hope you're having.
Me too. This is great.
It's kind of fun.
I'm learning.
Yeah, I get I don't know, I've always been attracted to like camera lenses, optics, and stuff like that, and I just view the loupes as an extension of that. And loupes can make a difference in your ability to do good dentistry.
Right.
So, yeah.
Yeah, I think it definitely improves your quality of work when you have a better view of what you're doing. So
the other thing I wanted to ask you, and whether we include this in the video or not, but is like, do you feel like your process for fitting loupes is different than other manufacturers? Like, is that like clearly some of the secret sauce for your company is the heritage, the optics. Mm-hmm. Some of it's also probably the contract with Oakley, so that like that's and then. But is like the fitting process? Are there any other kind of like things that you feel like elevates your?
Yeah. So if you just got fitted with another company, we might seem a little bit more archaic just because we're a little bit more manual in the way we fit. We've toyed with computer programs and iPads and cameras trying to visualize you and guess what your pupillary distance is, what your vertical placement is, and we keep coming back to the same thing, just kind of a manual process, and getting really good at it, so that we don't have to send those loupes back multiple times to get them refitted. Because with the ergo or ergo deflection loupes, they're very sensitive to misalignment.
Oh, 100%.
And if they're off 1 little millimeter, half a millimeter, it can throw off your view. And so we really want to nail that fitting right the first time.
100%. Yeah. My Designs loupes, I had to get readjusted. And both sets of my Hero Loupes, I actually adjusted myself because I kind of worn a lot of loupes. I kind of knew that, I need to bend the nose piece and change the frame, like bend the frame a little bit. And So anyways, let's get to it.
So I'm going to measure your pupillary distance first. Okay. So I'm not just measuring how wide your pupils are apart, but how far they are from the center line, so that we can target those oculars perfectly for your pupils.
One could be out or in.
Everybody's asymmetric. Yeah. There's like 1 in 30 people are perfectly symmetrical, meaning their one pupil's a little bit further out, or their nose is a little bit crooked, and so it throws that pupillary distance off on one side.
Yeah.
So I'm expecting you to be asymmetrical, just like I am.
Yeah, I won't feel bad
unless
about
you're
that.
1 in 30.
Actually, I already know. I already know.
All right, so I should explain. I'm just going to rest this on your nose. I just want you to look through the lens and focus on the green light. It'll be evident when we put this on you. And I'm actually have you take your hands, put this on like a pair of binoculars.
Okay.
So that you see well and you're comfortable looking and seeing that green light. Perfect. Good and good. All right, we're going to take this off, and I'm going to do it one more time. Same thing. Go ahead and put it on your nose so it's nice and comfortable and centered. Good. Focus on the center of the green light. Good and good.
Right. So the other thing is, loupes with a mask on is a little bit different than without a mask. I'm able to work around that by moving my mask around. I try to not get the mask under the loupe, but that's a whole.
So that's where this Ergo Fit nose pad that Dr. Chang invented is really nice, because not only is it adjustable, it's on 2 bendable wires, so you can bend it out if you have wide nose, bend it in if you have a skinnier nose, but it's also mountable in 3 different locations.
You can move it.
And it'll come to you mounted in the middle location. However, if when you're wearing a mask you find it pushes your loupes up too high, we'll just mount this in the high location, thus lowering the loupes and accounting for that mask.
Yeah.
Same thing if you feel like, they need to be raised a little bit, we could just mount it in the lowest holes, thus raising the loops up on your face. It's really nice. It's super comfortable. Everybody really loves this nose pad.
Well, the Oakley, I mean, if you've worn Oakley radar style sunglasses, like they're super comfortable.
Yeah.
Yeah.
Yeah. If you're an Oakley person, you're an Oakley person.
Yeah.
It's hard. Yeah.
Yeah.
Now,
what?
working distance. Do you happen to know, because you have so many loops, what your working distance is?
Yeah, I think it's either 17 or 19. It's
Gotcha.
Yeah.
So
fortunately, we're in the office. We could go check, but we can also use one of my reference loops, like probably one of these.
Yeah. Why don't you go ahead and put one of those on? I'm going to measure what your working distance is.
I think it's 17 or 19, but well, let's see.
19.
There you go.
Yeah. So that's another thing I was going to point out. A really cool feature with SurgiTel Loupes is if, when you get these, you find that you wish you had more working distance or less working distance, it's a very easy thing to change. We have working distance caps on the end of our loops that unscrew.
Cool. Okay.
You let me know what change you want in 1-inch increments, and I just send you or drop off some new working distance caps.
Okay.
And you screw them on, and boom, that changes that working distance instantly to whatever you want it to be. So you don't have to send your loops all the way back to the factory to have them redone like almost every other company.
How, like if I needed a different working distance on this, are they putting different optics in
Exactly.
here?
There's no way for them to change that. Yeah.
But that's cool that you can adjust that, because you're like, I love how they fit. I can see through them, but I just need a different working distance.
Yeah.
Easier for you too.
Exactly.
Yeah, that's nice. Okay.
So
what
now
else?
I'm going to measure your head width, because especially on Ergo loops, they can be very much affected by the frame bending out or bending in, and so we want to account for that. So I always measure your head width, and so we can account for that, knowing if you have a wider head, it's going to flex the frame out more, thus making the oculars bend in more. So we want to account for that. So you just stay there. I'm going to come up behind you and measure above your ears.
We can do that.
This is where I find out how smart you are.
Well,
super smart.
You know, if you measured my dad's head, he has a giant head full of so many brains, and so I wish he was here today. He's out. He's enjoying working 2 days a week these days, so which as it should be, and he's got a big head. Okay, what else?
So now I want to take a couple pictures of you wearing the loops.
Okay.
And this is how we're going to determine what your proper declination angle is, because this is a fully adjustable angle, but we want to find out what's comfortable for you.
Okay.
So I can either take this picture in here, or we should go into
We should definitely go the op.
Okay.
So we're going to pause the video, and then we'll just go do that. So we took the pictures from the front and from the side, and then we just the other thing is kind of interesting. So I sat in my normal position, and you know, we might be able, with these photos, we might be actually able to improve my posture, because maybe the way I've been sitting with my other loops is just to accommodate to the loops. So I don't know. That'll be interesting to see.
Yeah.
Okay.
Now, one more manual procedure that I want to take is your vertical placement. Okay. So you'll notice these oculars just have 2 little slits in them.
Oh,
so when you look through them, you're not going to be able to see an object necessarily, but you'll be able to see light through the slits.
Okay.
I'm going to move this up and down, and we want to stop it on the location in which you see the most amount of light coming through the slits, and that will allow us to know how high or low your vertical placement is.
Oh,
your nose, essentially,
okay.
and how high the loops will be sitting.
Okay. Should I grab a mask? No, because
that adjustability in the nose pad, we just want you to go ahead and go ahead and put these on, and I'm going to come over to the other side of you.
Sure.
And you tell me if you're seeing any light through them at all right now.
Yep, I am.
Okay. Now tell me, I'm going to move them up a little bit. Do you see more or less light?
A little bit less.
Gotcha.
Yeah.
Going to go down more than last time.
More than just a second ago.
Going to go down further. More or less?
Maybe a little bit less.
Okay. So your sweet spot was right about here.
Okay. That's really interesting. So essentially what's happening is I'm looking through like a tube, but it's a horizontal, right? And then you're just kind of seeing like more or less through that. So yeah, okay, that's clever. I haven't I don't remember having that done when I had my SurgiTels fitted in probably 2008.
Yeah.
But I haven't done that for any other loop fitting either, so that's kind of cool. Take it for what it's worth, I guess, huh?
Yeah.
Okay.
So yeah, we might have changed our protocol over time.
Yeah, that's neat.
So I think we talked about no prescription for you built into the Loupes.
Yeah, correct.
I'll have a customer who say, I don't have a prescription, but they wear readers at night. And so I always like double check to make sure they wear readers, because if you think about it, when you need readers, like me, your phone used to look clear here, and now it looks clear here.
Yeah, right.
It's the same with Loupes. If we set your working distance to 19 inches and you don't have your reader prescription built in, now you're really at 21 inches.
Yeah.
It works the same with, and so we always like to build in your reader prescription into the oculars, and it's free of charge with our company.
Okay.
And that just accounts for it
Into
and
the
makes sure that into the oculars,
cool.
always into the oculars, because that will make sure that working distance you're seeing is accurate.
Okay.
Yeah.
Cool.
But we don't have to worry about that when you're wearing contacts.
I really like the idea of the adjustable working distance caps too, because it could be where it might take me a couple months to realize I think I need another inch or less.
Exactly.
You know? So that's cool.
Or over time, that reader prescription affects your working distance, and we can now correct that with working distance caps rather than sending your Loupes back to the factory.
Cool.
How tall are you?
Oh, 5'7.5".
Gotcha. How old are you?
I'll be 41 in a couple weeks, so you can say 40 or 41.
Now, when you're using your Loupes, are you always sitting, or are you sometimes standing?
I do stand sometimes.
Okay.
For oral surgery, although, I kind of think that your Loupes are going to be my gamer Loupes, the ones that I basically wear all the time.
I hope so.
Yeah, I just based off of what I've seen today, like with the optics and the frames, will be really comfortable. I think I'll end up wearing them all the time. The real question will be maybe hygiene exams, because they're higher magnification.
Yeah.
I have been known to have 2 pairs of Loupes on, like one on my eyes and one around my neck. That's just how it goes. Okay, what else?
So now frame color.
Yeah, that's fun. Fashion.
Most people go with black. However, we have a new frame color from Oakley, a gray color. It's kind of a clear gray.
Yeah, that's
cool. They also come in a white color. You have
a
preference?
Man. I don't know. Well, I do have, I like this gray. This is kind of fun.
Yeah.
I like that sparkly one over there.
Yeah, unfortunately, this is a limited release,
cool.
and they don't have it anymore. That was a cosmic color.
Okay. Yeah. Let's do a phone a friend on this one, because fashion is, I think, black.
Mm-hmm. Unless you want to just be different.
Well, what do you think? I mean, if you're a patient, and would one impart more confidence or knowledge?
There's one color I didn't tell you about either. The new lilac color also.
He did.
Do you know that lilac is the color of dentistry? Did you know that?
No.
Lilac is the color of dentistry. And my gravel bike is UV lilac.
Oh wow.
Yes. So Janet's saying no. Janet's saying no. So what do you think? Which one?
The black ones.
Classic.
Are more professional.
You think so?
Yeah.
Okay. So
I do like those fine.
Yeah.
But it matches everything.
Yeah. And you don't say no on the white.
I would say no.
Okay. All right. So we'll go with black. There you go.
All right.
No, sorry. No, it's fine. I think the black is gonna be great. Thank you very much, Janet.
Yeah, thank you.
Okay.
Truth teller.
Truth teller. She's a truth teller. She'll tell you the truth. All right.
Okay, we're all set.
Cool.
Yeah.
All right. and it sounds, we hear the noise from patients are showing up, so this is good timing.
Yeah.
So I just want to thank you for the opportunity to do a review. I mean, I already kind of know this is going to be a good review, and that's independent of any outside influence. And I do think in general, I think you can't really go wrong in the marketplace with Loupes. But I do think you want to find something that really works for you. Mm-hmm. And the combination, my priorities are image quality, because that's what's delivering better dentistry. And these, for the deflections, I need to do a little bit of when I get mine that are customized. Mm-hmm. But I do think, just based off of the ones that are on the table, these are kick butt Loupes. So thanks for the opportunity.
It's been a pleasure.
Yeah, for sure. And we're going to turn off the camera, and then you can check out the rest of my collection here.
Awesome. Yeah.